Assalamualaikum and hi to Miss Azira and all my friends. My name is Nur Afizahani binti Zaini.
I'm Siti Nur Erina binti Murad and I'm from BBM September 21.
Hi everyone, I'm Sandhya here.
Hello, my name is Farhan Hakimi bin Pharmacology from PBM September 2018.
Hi everyone, myself Athlete Chandran from BPM. First and foremost, we must thank Madam Azira for providing us with the opportunity to speak about heparin. Move on to the presentation. I'm going to brief about what is heparin is. These are the points about heparin. I'm going to give more details about heparin other than these points. Basically, heparin injection is an anticoagulant. It is used to decrease the clotting ability of the blood and help prevent harmful clots from forming in blood vessels. This medicine is sometimes called a blood thinner, although it does not actually thin the blood. Heparin will not dissolve blood clots that have already formed, but it may prevent the clots from becoming larger and causing more serious problem. Moreover, heparin is used to prevent or treat certain blood vessel, heart, and lung condition. Furthermore, heparin is also used to prevent blood clotting during open heart surgery, bypass surgery, kidney dialysis, and blood transfusions. Therefore, it's used in low doses to prevent the formation of blood clots in certain patients, especially those who must have a certain type of surgery or who must remain in bed for a long time. Heparin may also be used to diagnose and treat a serious blood condition called disseminated intravascular coagulation. That's all from me. Thank you.
Let's continue with heparin's pharmacokinetics. The pharmacokinetics is divided into four aspects, which is absorption, distribution, metabolism, and elimination. So, the heparin's absorption is actually immediate on the onset after the IV injection. Since that, the bioavailability of heparin is 100% from the get-go. So the duration of heparin action till recovery is around 4 hours. Next is the distribution. It is understood that heparin is extensively bound to low-density lipoprotein, globulins, and fibrinogen, which means that it stays within the body quite a very long time. So the drug is actually distributed systematically, but do not cross the placenta. The heparin is metabolized and cleared through the articular endothelial system, and is partially metabolized in the liver into uroheparin. We can see that in eliminating heparin, a fraction of them is excreted through urine as unchanged drug, while the half-life is around 2 hours.
Hello, I'm Erina. So today I'm going to present about pharmacodynamics of heparin. The heparin is need to bind with heparin cofactors which known as NT3 or antithrombin 3 which produced by the liver in order to prevent thrombosis by inactivating the clotting factors. This antithrombin 3 will help speed up the pace at which antithrombin neutralizes certain active coagulation factors. So from the figure there, it shows that when we insert a small amount of heparin and it will bind with heparin cofactors known as AT3 or antithrombin 3, it will inactivate two factors, which is factor 2A and 10A, and this process will occur at a slow rate. But when we insert a large amount of heparin, it will bind with antithrombin 3, and again it will inactivating factor 9A, factor 11A, factor 12A. Heparin inhibits the activation of fibrin stabilization factor, which hinders the creation of a stable fibrin clot. Heparin also will prevent fibrinogen from converting to a fibrin. Heparin is not a fibrinolytic or thrombolytic agent, but it is used to stop existing clots from spreading by preventing a new clot from forming. Endogenous thrombolytics are used to dissolve existing clots. Heparin also helps to prolong the result of a number of coagulation tests, and the APTT is a test which also known as activated partial proton time is the most clinically relevant of all the coagulation assays. That's all from me. Thank you.
Hi, my name is Afiza. Today I'm going to present about the interactions of heparins with other drugs. So as we can see, I have stated some example of other drugs that usually can give an interactions with heparins. So the first one is a digitalis, nicotine, and antihistamine, which may partially counteract the anticoagulant actions of the heparin sodium. The next one is intravenous nitroglycerin, which used to heparinize the patient may result in decrease of the partial thromboplastin time with subsequent rebound effect upon the discontinuations of nitroglycerin. So the dose of the heparin must be reduced and is really recommended. And it also depends on the patient itself. So the third one is antithrombin 3 human, which is the anticoagulant effect of the heparin enhanced by the concurrent treatment with the antithrombin 3 human in patient who has hereditary antithrombin 3 deficiency. So to reduce the risk of bleeding, the reduced dosage of heparin is really recommended. So in our poster, I also have stated a small picture here. This is about the patients who have a cross-section of healthy artery. When it consumes the uncontrollable dosage of heparin, it can tear in artery wall and then lead to the fatty material is deposited in the vessel wall. And the worst, it can lead to the narrow artery become blocked by the blood clot. So I want to add some point. As we know, platelet inhibitors, which reduce the heparin dosage. Antiplatelet agent or heparin is really recommended to avoid the risk of bleeding, where the drug that patient consumes, such as ibuprofen, salicylic acid, and ASID drugs, please interfere the platelet aggregation reaction. So that's all from me. Thank you.
I'm going to present on side effect and toxicity of heparin drug. As our friend mentioned just now, heparin is an anticoagulant that prevents the formation of blood clot. Heparin is also used to treat and prevent blood clot in vein, arteries, or lung. Heparin is heterogeneous of unbranched polysaccharide chain. The major side effect of this drug is hemorrhage or unusual bleeding. Patient may experience unusual bleeding in their nose, blood in vomit, and stool as the effect of this drug. Next, vomiting is also a side effect of this drug due to response of body immune towards the drug. Moreover, some of them may have allergic reaction, for example, like rashes and also itching in their body due to allergic reaction of the drug. Then there is also research proof that osteoporosis may happen due to long-term taking of heparin drug. Furthermore, taking heparin for a long period of time can cause thrombocytopenia. This happens due to chronic usage of heparin, which lead to low platelet count in the blood. Lastly, patient may also experience with common symptoms like fever, irregular breathing, and also pain.